are a couple of key themes on the floor of this conference that shouldn't surprise anyone. They're themes that permeate the federal government's efforts now in all kinds of areas. Tim Boltz is healthcare strategist at Carahsoft. He tells me what healthcare leaders say are their top priorities now.
Cybersecurity is hot right now with the recent cyber attack at Change Healthcare that has disrupted this industry for the last 3 or 4 weeks. Cybersecurity is top of mind for everyone. And then I would say AI, ML, artificial intelligence, and the impact it's going to have on healthcare, not only patient care, treatment, but also optimizing the way organizations handle data, helping physicians get time back, be more efficient so they can spend time with their patients and optimize the care that they're delivering is I would say a close second. So those two, cybersecurity seems to be resonating throughout the entire conference, and then AI ML is the other hot topic that we're discussing.
The desire for organizations to be cyber secure seems self-evident, especially in the healthcare sector, so I'll go to AI and ML. I see a lot of focus here, not just on AI and ML for the sake of using it, but very specific use cases. What's driving that, do you think?
So our healthcare providers are being asked to do more with less. I think what the pandemic showed us was sort of how fragile, right, our frontline workers are. Workforce and just the burnout that physicians, clinicians, nurses, the people that are providing care, that's what every healthcare organization is struggling with. And so how do we make the people that are providing care that are quintessential to us, right? Receiving good care, being healthy, recovering from an ailment. How do we keep those frontline workers happy, engaged, still in love with what they do every day? And so the use case for me with AI ML is how do we impact those folks every day that come taking care of us, right, and give them time back in their day to really provide care, which is what it's all about. Not data entry, not being an admin, which is not what they went to school for, and not what they're highly trained for. And so that's one of the use cases that I see with AI ML, is that sort of automation and creating more efficiency. But then two, it's not far out, at least from a healthcare perspective, that our providers of care are going to be able to provide better treatments based on the power of AI and ML, right? The computational power of delivering, new treatments, new drugs, new protocols to treat cancer, and also autoimmune diseases that have sort of been on the fringe, right? That aren't mainstream. It's only a small percentage of the population that has these rare diseases. AI ML allows us to pour resources into treatment for those things that maybe haven't been done before, which will provide better care for all of us and make us more fit and more healthy, so that we can enjoy our lives. And so those are the use cases that I see in AI ML from a very, very, very high level. And then I would say the other thing that's driving this is data. We talk about AI and ML and sort of the power that it has to change the way care is delivered. But what I'm seeing is a lot of organizations need to get a handle on the data, get a handle on where data is stored, their governance of data, and then how do they access that data, which is really the driving force of AI ML, right? These large language models need data, and they need accurate data. And so I think that is what we as industry need to help our healthcare agencies with, is they have the data. How do we help them manage it, govern it, and really take advantage of it so that we can launch the AI ML of the future, which we haven't even thought about the impacts, right? I think it's pretty cool, but I don't know if we truly understand the power of AI ML currently.
Tim Boltz of Carahsoft at HIMSS 2024.